In the next minute, I'll cover what gluten is, and why it can bother you, and what it does and doesn't mean for IBD, and how I check if gluten is your trigger. And the reason I want to do this video today is because I saw several patients, many of whom are on gluten-free diets already, and this is simply because they have Crohn's, ulcerative colitis, or simply bloating, and they're concerned about gluten. I'm Dr. Pranab. I'm a gastroenterologist. I've looked after patients with gut problems for over 25 years, first in London and now in Dubai. Now, gluten is a protein that's particularly in wheat or barley, and we humans cannot really fully digest it. Leftover remains of it get into your gut and make you feel gassy or bloated. That is quite common, but does not automatically mean you have something like celiac disease. Now that is very different. It's an autoimmune condition where gluten that comes from wheat actually damages the small intestine. Now that affects about 1% of people, and that needs a strict gluten-free diet for life. Gluten does not cause Crohn's or ulcerative colitis, and eating more or less gluten does not change your chances of getting IBD or IBD flares. Now, because celiac is an autoimmune condition as well, it is a little bit more common in people with IBD. So, although still uncommon, it is why we test rather than guess if gluten may be causing you more inconvenience than it should. First, I test for celiac or gluten sensitivity while you're still eating gluten. So the test is much more accurate if you're on gluten already in your diet. Now, if tests are negative, we do a short gluten-free trial for 2 to 4 weeks. Keep everything else the same and track your symptoms. If you feel better, gluten may be your trigger, but if not, we look for other triggers.